Good morning. I'm Dr. Jack Chapman of Gainesville Eye Associates here in Gainesville, Georgia. And we've been doing a lot of telemedicine here lately while we're in this shelter in place. And part of that reason is to help keep our patients safe and to keep us safe so we can maintain that distance as needed. And so we're using telemedicine a lot more during these times. And the reason we're doing that is to mainly kind of talk to the patients ahead of time, get the history, find out what's going on. And actually, we can even examine, as you will see in the sample here, we can actually examine the anterior segment, the lids, conjunctiva, cornea. And if we can see the anterior chamber in the iris, then we know that that's in good shape. So we get kind of a gross exam of what's going on with the patient. And along with that, with the history, a lot of times we're able to treat the patient through telemedicine. If it's in something that by history or vision or whatever appears to be affecting the back of the eye, the retina, or others, then we take and go ahead and schedule them to come in an urgent or emergent, depending on the necessary need of what the case entails. We are seeing urgent and emergent patients in the office taking safety, using the N95 mask and the appropriate precautions, and washing our hands real good and wiping down all of our equipment and everything with an antiviral solution before and after we see somebody in the office. And so we take all the necessary precautions. So if we need to bring you in, it will be done in a very safe manner, keeping everybody apart as much as we possibly can. But telemedicine has been really good for us in this part, for us to be able to screen and take care of patients and also check in with our patients. A lot of them are, homebound. And so being able to talk with them and see them and everything, we also are helping them out in that way as well by being able. So we've had a lot of positive comments, a lot of positive feedback for us doing telemedicine from this standpoint during this. And so we probably are, in times going, our new normal is going to entail telemedicine being part of it. So what we will do in the new normal, we will use telemedicine to contact the patient beforehand to talk to them, get their information, update their insurance information. Then we'll have a tech contact them via telemedicine, who will take the history and update their medications and get their chief complaint. And a lot of these things that we had been doing in the office with the tech, we're going to do outside of the office beforehand, so that when the patient gets here, we already know what we need to do. We've already got the history there and the chief complaint, and the record is updated. And so then we can take and just do what is necessary to see the patient, to limit the exposure time of the patient and us to the patient in the office, and make things a little more efficient going forward. So telemedicine is going to be a big part of playing in our future as we go along. Another thing that we'll try to do with that, if we have someone who comes in with cataract surgery and they need to see the cataract counselor going forward, that most likely will not be a face-to-face meeting in an office with two people sitting across the desk from each other, because there again, that's getting people close to each other. So we will do that via telemedicine as well. Of course, we'll take care of the consents and all of that stuff appropriately. But there again, we're taking extreme measures to do what we can to help keep our patients safe, but also provide the care that they need during this time.